Hi again to everybody that was in the session before. Um, so I am going to sort of switch gears from what I was talking about before and sort of talk a little bit more about the research that I do um, in the rare disease caregiver space. Um, what I really would like to do here today is kind of set the stage for Grace and this awesome study that she and I helped a little bit in conducting the rare disease caregiver survey, but I'm going to talk about another study that I did on a much smaller scale. So the overall goal here is to really kind of foster discussion on basically rallying the community, getting the community together to sort of figure out what is the best way as a community, as a system to address and better understand and perhaps improve the rare disease caregiver experience. And so, what I'd like to ask the audience today is, when we get to the discussion part, to let's if we could kind of focus the discussion on more community-wide initiatives or more community-wide approaches towards addressing the caregiver experience. Grace, did you want to say a little something with regards to that in terms of what we're trying to accomplish?
Sure. I mean, I would say, the session before this was about sort of that individual experience. But from our perspective at the National Alliance for Caregiving, we think that what you're going through is really part of a larger public health issue in our society. And so we're going to talk a little bit about the research that we use to make the case to policymakers, providers, drug manufacturers, innovators, and others that we need to do something to help support friends and family members.
Thanks. So, as I said, my purpose, my role here is to really set the stage for the Rare Disease Caregiver Survey study. But what I'm going to do first is talk a little bit about some of the research that I've done on a little bit of a smaller scale. So I do research with Zellweger spectrum disorder, which is the disease that my son had, and I want to give you just a sort of a little more sciencey background on ZSD. The incidence rate is about 1 in 50,000 children. For a rare disease, truthfully, there's a decent amount of literature out there on ZSD. It's still, it always could be better. But what's not out there is the tremendous impact that having a child with ZSD has on the caregiver. There's no caregiver research out there on the impact of ZSD and many other rare diseases on the caregiver. So as a result, that experience is very poorly understood. Talking about rare diseases in general, as we probably already know, caregivers play a very, very important role in facilitating care for their children. When I talk about caregivers, in the context of this study, I included parents, step-parents, and legal guardians of children, but caregivers can also be grandparents, they can be siblings, they can be friends. The definition of the caregiver is actually quite broad. Caregivers, especially in these medically complex conditions, they often have the best insight on coordinating care across multiple specialists. Something that I know that Grace is going to touch upon is that being a caregiver is a long, long job, and it's generally a lifetime commitment. And there is research out there that shows that the stress of the caregiver can actually affect the outcomes of the patient. Despite all that, not a lot of research out there on rare disease caregivers, and when you don't have a lot of information in a specific research field, a good way to sort of start gaining more information is to have conversations directly with that target population, in this case caregivers. One way that I actually propose to use it in my study is looking at qualitative research methods, sort of beyond just asking people survey questions, like actually asking them very contextual type questions. What is your experience as a caregiver? So they have the freedom to talk about almost anything they want to within that caregiving experience. So I used that approach to propose a study that was actually funded by the Global Genes Rare Impact Grant during the 2017 cycle. And basically, my goal was to understand and describe what the caregiver experience was, what the ZSD caregiver experience was. Now, I'm going to be speaking, obviously, specifically to about ZSD caregivers. But what I kind of want to emphasize here is that that experience of being a caregiver to a child with ZSD, there are a lot of shared similarities across many rare diseases. So, sort of keep that in mind as I go through this information. I'm not going to spend too much on the nuts and bolts of it, but basically, we did this series of 3 focus groups at a Global Foundation for Peroxisomal Disorders family conference, and we basically had these 90-minute group interviews asking families what their experience was. And I'll talk a little bit about some of the questions that were asked, but this is just our timeline for our study. We conducted the focus groups during our conference in July 2017. Prior to that, we were planning and preparing for this focus group. And when you get a bunch of caregivers that don't necessarily get to share their experience all that often, guess what happens? They talk for a really long time. So we ended up with, when we tried to transcribe this, we ended up with 150 pages of text. So we spent a little bit of time trying to analyze all that data. So that was what we've been doing over the last year and a half or so. These were some of the questions that we asked our families, but really this was what we referred to as a semi-structured interview guide. So we asked these questions, but we let the participants really kind of decide where that conversation went throughout the course of that focus group session. So we asked questions about their emotional experience, what were the challenges they faced, what did they do to cope, and this sort of informed how we kind of analyzed our data. So just a little information on our groups. We had 3 focus group sessions. One had, 2 of them had both parents of living children and bereaved caregivers. One group had actually predominantly, were parents of predominantly older children. And what did we find? Well, we found, this is actually during the actual focus group, we found 3 common themes, okay? One was with regards to the emotions that they experience, and what we found is that there is a large range of emotions, something that you may identify with, this common theme of a roller coaster, and I'll talk about that in just a second. The next theme that we found were identification of stressors that contributed to this emotional experience. And then the last theme was looking at what were the coping strategies that our families used to help address that emotional experience. So going back to the range of emotions, I'm very tech deficient. So it's a roller coaster. You may have heard this over and over and over again at this summit and any other patient advocacy conferences that you've gone to. But the truth of the matter is, there's not a lot of information about this kind of sentiment in the literature. So I think it's pretty noteworthy to state that nearly a third of all of the caregivers in that focus group explicitly describe their emotional experience in that way. They use the same exact terminology. And this is really just referring to the fact that the emotional experience is not static. It changes based on what the current triggers, stressors, or events that are going on at that time. Again, this is not rocket science, but just to sort of characterize what this experience is like. And so I've put a few sample quotes here. You can read them now, or I can certainly give you my slides. Our second theme was looking at the stressors or the triggers that are contributing to this emotional experience. Okay, and one had to do with the burden of caregiving tasks and having them change and be reprioritized based on what was going on at that time. Another common stressor was interactions with lots of people, but mainly medical care providers, where the parents felt like their voice wasn't being heard in the management of their child's care. And then overall, this caregiving experience having an impact on every close relationship they have, especially if these relationships, the people in these relationships weren't involved in the everyday care of their child. ZSD is a life-limiting disease with very little natural history information. So one of the things that our families talked about is really just stressing out over not knowing what's going to happen next because there is no natural history for this disease, or very little natural history for this disease. And sort of on the opposite side of the same coin, despite not having a strong natural history for this disease currently, what we do know is that this is a life-limiting disorder. So another big stressor for our families is that knowing that someday their child may succumb to this disorder. So that was another stressor for our families. And then another one I think is really important is the impact that this disease has on not only the child, not only the caregiver, but the rest of the family, the other children that are in the family. And that was a big point, a big stressor for our families. So let's talk a little bit about coping. Now, when we tried to sort of piece out what were the common coping strategies among our families, what we found is that there were what we referred to as cognitive coping strategies that we saw. And when I say cognitive coping strategies, what I really mean is sort of changing your thinking. One very, very common theme was this new normal idea, and really just sort of readjusting what they believed parenting was going to be like. Recognizing the support that they have around them, whether it be through patient advocacy groups, through people outside of their family, or supportive medical care providers. Another sort of category of coping strategy that we saw were what I refer to as behavioral coping strategies. And what I mean there is sort of engaging in actions to help address and manage that emotional experience. And the most common behavioral coping strategy that we saw is this idea of advocating on the child's behalf, making sure that when discussing care for the child with a medical care provider, that what is being addressed is what is the best care that's in the best interest of the child and in the best interest of the family. And then among our older families, what we found is that allowing their children some semblance of independence was actually very was a really good source of solace for not only the parent but also the child. So that was another theme that we found. And I'm going to talk about some session-specific findings that we observed. Especially in our younger groups, we found that with regards to diagnosis, again, this kind of back and forth emotional experience, while the diagnosis itself was quite devastating, it provided a lot of relief for some of these folks that had been on this long diagnostic journey. Going beyond tailoring and advocating on behalf of tailoring care and advocating on behalf of their child, looking at whole community advocacy. This is something that was a very common theme among some of our family members. Getting involved in perhaps affecting policy, starting their own nonprofits, getting involved in overall community advocacy for their disorder. Among our bereaved parents, what we found is that a lot of these families found a lot of comfort in talking about their child. So I tried to set up, I have no background in psychology or anything, so this is just me being, I don't know, not a psychologist, but trying. And what I tried to do is really put together a kind of framework that linked all of these three themes. And so I've provided a few examples here where we look at these specific stressors, in this case, negative medical care provider interactions, contributing to feelings of frustration and confusion, and then utilizing this coping strategy of tailoring their child's care, advocating on behalf of their child to address this whole experience. Looking at the impact of the disease, this disease is progressive, and that's sort of contributing to feelings of devastation, and then redefining, and then using this coping strategy of redefining what normal means to address this emotion of devastation. So what I've summarized here is really talking specifically about ZSD, but again, I think this is a spectrum disorder. We had families from all different ends of the spectrum here, very, very different experiences, and what we found is that they all had very shared, similar experiences, despite, this broad spectrum. And what I'm, although this is a small kind of microcosm of, the whole rare disease caregiving space, I'm guessing that there are a lot more shared experiences across many rare diseases. So the hope here is this study to provide a starting point for characterizing the rare disease caregiver experience, looking at developing more evidence-based research on what are the tools and resources that caregivers need to help manage their experience being a caregiver, and then letting that information help inform and mold how policy moves forward. And I think Grace's Rare Disease Caregiver Survey is a really good first step in doing that. So I will take questions at the end, but I just want to thank Global Genes for funding this study, and a bunch of other people too that are very important. So I will pass it on to Grace. There you go.
Yeah, thank you. And I'm going to, so my colleague Maya is here helping. We also have Panda Bears, and they're not just fun to relieve stress. I will let you pass them along. But they also have the URL for our study. So if you're interested in learning more about the study I'm going to talk about, it's right there on the bear's belly, which is adorable. So anyways, well, I'm Grace Whiting. I'm the president and CEO of the National Alliance for Caregiving. And I'm going to walk you through a little bit about what we do in Washington, as well as the findings of this study. Did you click right?
Yes.
So if you're not familiar with us, we are a think tank in Washington, D.C. We do policy work on family caregiving across the lifespan. So not just rare disease, but also conditions like Alzheimer's, cancer, mental illness. And we study how can we empower from a systematic level what families are going through when they're trying to care for someone else. We lead a grassroots network in the states and communities, and we also are the secretariat for a global coalition of family caregiving groups that represent 16 different countries around the world. Has anybody seen Mr. Smith Goes to Washington? Okay, yes, okay. So if you're a policy nerd like me, this is like one of the best movies about lobbying and lawmaking. But what I wanted to raise here is that in order for a policymaker to act, you need stories and evidence, right? And that's, if you want to be cynical, if you watch this movie, one of the things you learn is that you're not going to get by just on goodwill alone, right? Mr. Smith goes up to Washington. He's a Boy Scout. He's ready to persuade Congress to do things, and he hits some pretty starch obstacles. Is what I'll say nicely. I'm not going to draw an analogy between this world and our world today, but I'll just say that it was a little bit challenging. And I think the first thing you got to remember is if you're in a congressional office, or if you happen to meet with somebody from the administration, or you're working with a federal agency, when you are doing those things, they have several competing priorities. And so, as mercenary as it sounds, they have to decide which of these issues is most important. And one of the ways that they narrowed that down is being able to describe what the issue is and how we're going to tackle it. So how big is it? Who is affected? What would help the people who are affected by this issue? How much is it going to cost us? And how would those solutions work? So I'm not going to go through all of these bills. Schoolhouse Rock, if you remember before, more recent iterations in our policy world used to, the bill goes to Congress and then becomes a bill. It doesn't always happen now. Now there would be Bill and his friend continuing resolution and his, his friend filibuster and so what. But I think the big takeaway here is that caregiving is gaining momentum. So there's a new law that passed that said we're going to create a plan for caregivers at the Department of Health and Human Services. There are new appropriations for the few federal programs that support caregivers. There's new money to create a volunteer caregiver workforce, sort of like AmeriCorps or the Peace Corps. And in the States, there's an effort to integrate healthcare with community-based care so that if you're caring for someone who's in the hospital, that the hospital has to recognize the caregiver in the medical record and provide discharge instructions. So just from a big picture, think about caregiving is gaining momentum. So what about this report? So my colleague passed out the reports. I don't know if anybody has one in front of them. So it's a beautiful 90-page novella. And what I would say is there's a lot of data in there. So if you look at it and you say, gosh, there's a lot in here, I'm not really sure what to take away from it. I'm going to give you some of the highlights. I would also say our door is always open to you. And I would note that the data set that was created in this study will be made public so that researchers can look at other pieces of the data or analyze additional questions that we may not have covered in the study. Couple of big things. It was not possible without Global Genes. It would not have been possible with the amazing grant funding we got from a number of companies, some of whom I see in the audience. And if you flip on the back of the cover of this report, you can see the companies that we worked with. And we also had an independent advisory committee. And the reason for that is to make sure there's a firewall and there's an independent group of reviewers who look at the data, who look at the questionnaire, and help us do the recruiting for the study. The one last thing I would say is one of the people on our advisory committee, Jack Whelan, was a cancer patient and a rare disease advocate, and he had multiple myeloma, and he did actually pass away before the study came out. And so I just feel it's worth mentioning that, you know, how important it is to do this kind of work and get involved in research and how much we appreciate it because it's something that can live on even as people approach the end of life. So methodology. So 1,400 adult caregivers of people with rare disease were captured in the study. Now, you've heard people talk about sometimes siblings or other children in the household are doing some caregiving. We did ask a question about that, but the focus of this survey was really adults caring for adults or kids. We also captured more than 400 diseases, and we have an appendix on our website that lists all the diseases that we captured. So when that data set is made public later this year, you can look in at the specific data for your disease state. These were the most commonly mentioned rare conditions, and there's a couple of, if you look in the report, there's a couple of case studies for these larger groups where we sort of identified, okay, these are how the adult diseases look a little different than the pediatric diseases. And then finally, I would say this is a deep dive. It's not nationally representative, which means that the data skews a little bit to the side of being white, college-educated women, which, you know, that's fine. I'm one of those. That's fine. But, but from a research standpoint, it probably does not accurately state, you know, what the impact is on multicultural populations, on men, on other people who are doing caregiving. So just keep that in mind that this is one situation that we're sort of digging into. Common themes, family connection. So more than other disease states, you know, typically in rare disease, we're looking at people living together in the same home as a family unit. It's a life-altering experience for the family. Again, more than other diseases, caregivers are the voice of care. They are really advocating for people within systems of care. There's a lot of strain and stress related to caregiving, which we've talked a little bit about, and there's a ripple effect. So, you know, traditionally we think about, okay, we have one person who's sort of caring and another person who's receiving care, but there is a ripple effect across the whole family. And there are also situations when the person receiving care is caring for the caregiver. So that's something that really emerged, I think, in this data. So now on to the stats. Who's excited? I am thrilled. Okay, so we're going to walk through the graphs here. So rare caregiving is a close family role. You can see that in our sample, 60% of people were caring for their own child under 18. But what I would note here, it's not insignificant, 14% are caring for a spouse or partner, which is a very different type of caregiving situation. And you also have someone else. So people who were caring for their own parents, for a grandchild, for a sibling, and even people who are caring for non-relatives. So in our national study that we do with the AARP, it's about 15% of Americans are caring for someone they're not even related to, neighbors, friends, and so forth. And I think you see that a lot in the narrative stories that you hear here at Global Genes, is friends caring for each other, communities caring for each other. The other thing I would say, the reason it's important to note that people live together is because when you live with someone that you're taking care of, that is a factor that amplifies the stress or the impact of the disease. So co-residence can sometimes make it more stressful on the family. The other thing is rare caregiving lasts for 9 years on average. And what we have broken out here is adult recipients on the right-hand side. So you're caring for an adult. Children, you're caring for someone under 18. And you can see 1 out of 5 people are caring for 15 years or longer. So to put that in perspective against the national data, if you're caring for someone with dementia, it's typically about 5 years, although sometimes it goes longer. Cancer's about 3 years, but sometimes it goes longer. But 15 years or longer is an incredibly long amount of time to be taking care of someone and to be doing the kinds of activities, helping someone get dressed, helping them eat, helping them navigate their care. And so that, again, is another stress factor that's sort of unique to rare caregiving. It can also be a full-time job. So I put in quotes typical because nobody is typical, but rare caregivers can spend as much as 37 hours a week providing care. And if you're caring for kids, it could be 53 hours a week on average. I'm not going to get into this too much, but I think the idea here, and many of you who are doing this, recognize that there's a lot of impact on your health and your own health and wellness. And one of the things that I've noticed as I've come to Global Genes the last 5 years is that sometimes we forget that the caregiver is a different person than the person with rare disease. Both are part of this really critical family unit, but the caregiver themselves, the person who's doing the care, needs their own accommodations, needs their own ability to take time off of work, to have a life, to have an identity that's outside of this caregiving relationship, to be able to navigate stresses in the family. And so I think that's something that really bore out here, particularly the impact on the emotional and behavioral health. The other big thing, and this is where we start getting into public health issues, is that caregiving can impact your financial health and well-being. So we asked a question not just about financial strain, but also about the impact on specific pieces of your life. So for example, we had filed for bankruptcy. 9% of people in our sample filed for bankruptcy because their family could not afford the cost of care, had to sell a large asset that's more than 1 in 10, move to a less expensive home, more than 1 in 5, and then you can see other impacts here. And this is something that's the entire family, right? Like everyone in the family is having difficulty covering the cost of care. Now the cool thing is that rare disease advocates, more than other diseases, are incredibly activated. So we ask this question. This is data from our national study, and I'm comparing up here this is a statistically significant sample of the US, all caregivers, and then secondary analysis on cancer and dementia. So we ask these questions: what are you doing within systems of care? So you're communicating with healthcare professionals, and you can imagine that that's the same kind of thing that you might do if you were a nurse or a social worker or someone on a care team. You're monitoring severity of the condition to adjust care, and you're advocating with healthcare providers, community services, government agencies. I would also think into that, insurance companies. And so you see most caregivers are doing this, roughly half. When we look at cancer, it goes up a little bit. We've got 82% here, 76%. When we look at dementia, it goes up. And what that tells us is the more medically complex the condition is, the more likely it is that you're going to be doing this kind of patient advocacy. So let's look at rare disease. Now, with the caveat that this is a different sample so that we can't directly compare, we know when we ask the rare disease people that 9 out of 10 people are doing all of this. And in addition, these caregivers are educating healthcare professionals about rare conditions. And you know what shocked me a couple years ago? I was here at Global Genes,
And there was a mom who stood up, and she herself had the condition, and her daughter had the condition, and she said she actually memorized the standard of care for the disease because her physicians just did not understand how to treat it. And I would say that in a strange way, you guys should be incredibly proud as a community, because almost nowhere else in the healthcare system are people so activated and engaged in the care that they're receiving and their family's care. Now, some places where we probably need more help. We ask this question in most of our studies about what medical or nursing tasks are you doing? So we talk about, for example, tube feedings, wound care, managing blood pressure. I always sort of smile at this because about half of people are doing it without training. And I just think about like my husband coming towards me like, oh, I'm going to do a catheter, and me being like, no, sir, I don't think so. You have not been trained. And that's how I react every time I see this. But, you know, to be less flip about it, for a lot of people, it's very concerning to, you know, you're caring for this person you love, you're dealing with complicated grief, you're stressed out, and now you're thinking, oh my gosh, I don't even know how to give an injection, or I don't even know how to use a feeding tube. And so this is an area that's a huge area of need for many people. So what about the future? One of the cool things about the rare caregiving community is that people participate in clinical trials. So we have 1 out of 4 participating in the trial, typically or more often adults than people caring for kids, and helping with a lot of different types of activities. So we've got some of those listed here. And then here's a bigger chart that sort of shows, so, you know, things like filling out forms and paperwork, transportation, coordinating care, researching the trial. And the ones that surprised me, traveling 3 or more hours to get to a trial, 43% of people. Moving away for a month or more, it's like 10% of people who are caring for kids. So very surprising. So what next? So what we were thinking about as we were looking at this data and trying to digest everything is what is the role of the family in a clinical trial, whether it's for drugs or devices. And in particular, not only what is the role of the family, but what does it make sense for the caregiver to do? And there's really 3 different roles that we came up with looking at what the FDA has examined. So there's proxy reported outcomes. You know, I step in the shoes of the person who is the patient, and I report on their behalf as if I was them. There is observer reported outcomes, where I report on objective data. So like, for example, my son can no longer walk across the room. That would be something I might report out on as an observer. And then from our perspective, self-reported outcomes. What's the impact of the disease on our entire family unit, not just on the person who's the patient, but on the entire family unit? So what does it mean in terms of, my economic impact, the expense that the disease is causing us, lost opportunity costs from not being able to develop better relationships or being able to save for my own retirement or engage in my own career. So that's sort of the big picture that we're thinking about now. Now, the FDA has started thinking about new ways to amp up the current patient-focused drug development program, and they're starting to think about caregiving, but it only kind of pops up here and there. And so we're doing some work with several other groups to try to articulate this is what's happening in patient-focused drug and device development with respect to caregiving, and to help people think it through if they're designing or developing trials. The last thing I would say is our digital door is always open to you. So you are welcome to email me or my team with questions or thoughts or ideas about the things we're working on. And that's all I have. I'm going to come back over here to the Oprah chairs. I think we're open to take questions. So.
All right, does anybody have any questions?
So you glossed over some of the policy that's being worked on, but what are some of the policy impacts you see that might come out of this study or others like it in terms of just the needs of patients and how they can be met?
So the first thing I would say for rare disease is bridging this gap between what's happening in pediatrics and adulthood, that transition of care.
And in particular, Medicaid has a lot of variation from state to state. So in some states, on the Medicaid program, you can receive, funding to care for your loved one. In other states, you're not allowed to do that, basically. In addition to that, I think a lot of times people in the rare disease community may not realize that there are resources in the disability community, particularly among IDD groups like the ARC of the United States, that could be helpful in navigating some of what's happening in rare disease. And then likewise, I would say a lot of the Disability and Aging Network, which has done the work to build an infrastructure for caregivers, forgets that people might be dealing with medical conditions like rare disease. And some of that's due to sort of underlying philosophy differences. But in general, I would say there's a silo there, so that's one piece. The other, I would say, is people feeling comfortable talking about their experience. So from a workplace standpoint, recognizing FMLA, for example, might apply for you. In states that have paid leave, you might be able to take paid leave. But because the condition is not well understood, it can sometimes be difficult to self-advocate for yourself to take advantage of those benefits when they're available.
Out of the survey you guys did you ask whether they were male or female caregivers?
We did ask that. Now, so one thing I will say is, in general, if you just look across the entire United States, there are 40% of caregivers are men. In our study of rare disease, we had about 10% male respondents. Now, I think partially what happened there, and this is like a mystery of research is that men don't see themselves as caregivers, and they don't see the activities they're doing as being caregiving activities. And part of that is, in general, men and women care differently. So men tend to do more hands-on, tactical types of activities. If y'all were here in the session before, I think you heard that a little bit. Steve was saying, like, I'm building things, and using technology, and then Gay handles the IEP and the paperwork side. So I think men sometimes don't self-identify to participate in research, but we did ask that. We have a number of demographic questions broken out in the back of the report. Yeah, I think that's true, though. I mean, traditionally people think of caregiving as sort of women's work, for lack of a better description. Now, I think among younger people, those sort of gender norms are changing a little bit, but part of that too is sort of figuring out, like, who's doing what.
There are some, not many, but there are some peer-reviewed literature sources that have identified that caregiving, particularly in I've only focused on rare disease literature, but that it is indeed gendered. I don't remember exactly how they characterize that, but there is a very distinct difference between caregiving as a male and as a female in the literature that I've read.
I know you said your study didn't focus on the sibling aspect of it, but I think that would be very interesting to learn about how the sibling being the caregiver impacts it. Like, my 14-year-old already knows she's going to be responsible for her sister when she's in her 30s or 40s. Mm-hmm. And I'm very lucky. She's not jealous. She's active in all the therapies. She wants to know more. But as a parent of two children, one with a rare syndrome and one without, I would be interested in what can I do to make sure that although this will impact the sibling's life, it doesn't impact her to the point where she says, I can't go to the movies because we can't afford it because of my sister, which I haven't heard, but a friend of mine has heard. So to find research best practices for parents of multiple children would be hugely impactful for us as caregivers.
So I would say the University of Illinois in Chicago has this awesome group that we're part of called the Family Support Resource Center, and they've got some resources on future planning, because a lot of that, I think, is future planning. I don't know if you want to speak to the family dynamics in general. I would say that I think to some degree it's going to be unavoidable, right? And that's what we're saying when we see the ripple effect, is that to some degree everyone is impacted by that. And I think it's important to remember that it's us against the disease, You know, there's some really cool, if you're really bored and you want to go on and watch TED Talks about caregiving, fantastic researcher named Frances Lewis, and she studied breast cancer dyads, and she found that the families viewed the strain of the disease as being an issue with their marriage rather than, you know, we're both dealing with this really intense situation. And when they were able to teach people how to be better listeners and to do more self-care, they could improve that, both the relationship and the health of both people.
You know, I don't have much to add here. I think Grace hit upon some good points, but I think, you know, that ripple effect, it can be negative, but it can also be positive too. I've talked to many parents that have said that, you know, their other children have actually, you know, pursued careers in nursing, and, you know, as a result of their experience with their siblings. So, you know, I think there could be some positive aspects of that as well. Sorry, I don't have much more to add.
Well, you know what I would say is actually that would be my situation. My sister had pediatric brain cancer, and she's fine now, except for being sort of a hippie and an artist and a bohemian. But besides that, but it did have a really long-reaching effect on our family. You know, when I look back, there were things that I didn't understand. Like, you know, I didn't realize she was going through chemo, but she would go to the hospital and I'd make fun of her, like, oh, you're going to get stuck with needle, you know, which now I'm like, gosh, I was evil. I was an evil child. But we're very close. And, you know, I think it does make you, in some ways as a sibling, empathetic to what's going on and more attentive to the fact that people are dealing with these issues around you and you may not always notice it, you know, and people may not be open about it.
I piggyback off that. My brother has Duchenne muscular dystrophy, and my parents have encouraged us to get involved, and now I'm in a career with that as well. And I think, you know, I'm glad my parents pushed me, and I'm not afraid. And if something were to ever happen to my parents, I feel like I can take the role of over my brother, and I do think encouragement is a big thing with siblings. So.
I was just wondering if you ever came across this. My husband passed away a few years ago, and I was his caregiver for a year and a half, 24/7. So I was really exhausted, and what it came down to was about a week or two before he passed, actually before that, I started feeling that maybe I had diabetes because I was always thirsty, and maybe I had some type of bone issue or whatever. So anyways, what was interesting was I did come down with 3 diseases. One was rheumatoid arthritis, another one was fibromyalgia, and another one was diabetes. And I was reading something from a Caregiver magazine online, and they said that there were 4 things that people who did caregiving 24/7 came down with, which were the 3 I mentioned, plus cardiac problems as well. And I was wondering if you came across this, and I wanted to emphasize that to everyone who is a caregiver, you should get as much respite and help as possible. Unfortunately, the country I'm living in, Portugal, is not well. Respite and home care is very difficult to get, if at all possible. And home care there basically just exists of doing hygiene and feeding, and that's it. Did you come across a study like that at all when you were doing this?
So, well, first let me just say I'm sorry about your husband. And there is lots of research across all different types of caregiving that when you're caregiving, you forget to take care of yourself. And so you may experience health issues because you sort of put it off. You know, I heard this story once about it's like a caregiver and the recipient come to the hospital and one person's really well groomed and looks really nice. And the other person's just, you know, very frazzled, hair sticking up. And which one's the caregiver? And it's typically the person with the hair sticking up because they spent so much time trying to make sure this other person is doing okay. There are a couple of studies, although they're in the minority, that show that the experience of caregiving can improve your self-esteem, can give you more meaning in your life. And there was even a study at Johns Hopkins a couple years ago that said he can make you live longer. So I do think that we don't always talk about the positive side of it, but and this conference in particular, it always strikes me like how meaningful it is to be able to walk with someone through this life-altering experience, and particularly to walk with someone through the end of their life, and to be the kind of person who cares for them. Now, that said, it may not make you feel better. There's some very dark existential pieces, I think, of caregiving, but knowing that there is a positive side of it, I think is really important.
I think so. I agree. I don't have anything to add. I will say, with regards to what you're experiencing, again, in the small study that I did find a lot of parents, especially parents of older children, that had, that very explicitly stated the impact that caregiving has had on, their overall physical health, having to lift their children, developing, sciatica and all, and not necessarily thinking of it as not a top priority in their life because of having to take care of their child, and that was their priority.
All right. We might just bring questions up to the front since we're wrapping things up. But I just really quickly wanted to again thank Grace and Mousumi for presenting today, and just a reminder about the night reception that is sponsored by Shire. Thank you everyone for coming, and we can take questions up here.